Hey guys, hello and welcome to my YouTube channel. In this video, I am going to talk about inflammatory bowel disease. So guys, inflammatory bowel disease is an inflammatory condition just like the other inflammatory conditions, and in this case, the site of the inflammation is your gut or the site of inflammation is your bowel. So, to be very simple, it is an inflammatory condition in which the gut or the bowel is inflamed, and as a result of the inflammation in the gut or the bowel, what we will get is diarrhea. Obviously, because whenever there is an inflammation going on in the gut, the first symptom would be diarrhea, and second thing we'll get is the abdominal pain. So, in a very simplified manner or in a layman's language, diarrhea and abdominal pain are the main manifestation of inflammatory bowel disease. But now you will ask, like, okay, Speedy, so diarrhea and abdominal pain we get in so many conditions. Like let's talk about Shigella's dysentery. We have diarrhea. We have abdominal pain. Let's talk about Salmonella. We have diarrhea. We have abdominal pain. So how do you differentiate? Like it is an inflammatory bowel disease or it is a simple infectious condition? So I'll tell you one thing. Always remember that infections, they don't last for months or years. Okay, so they do not last for months or years. Whereas if we talk about inflammatory bowel disease will typically present with a scenario in which the patient will come and say, doc, I am having this diarrhea for like last 6 months, and it is like paroxysmal. So there are days in which I am fine, and then there are days in which I feel the worst. Okay, so there will be paroxysms, or what I can say is that there are flares. Whenever there is an inflammatory condition, let's say lupus, or let's say rheumatoid arthritis, or let's say any other thing, there are flares. Okay, there are flares and there are remissions. So in case of inflammatory bowel disease also, there will be flares and there will be remissions. Okay, so till now we have studied that inflammatory bowel disease is a condition in which we have the inflammation going on in the gut, we have inflammation going on in the bowel. As a result of that inflammation, we will have diarrhea, we'll have abdominal pain. And how do you differentiate it from infectious pathologies like Shigella, Salmonella, or any other thing? Is that those are transient, but this is like spanning over a period of like months and years. Okay, now if we talk about what are the various subtypes of inflammatory bowel disease, and what are the various manifestation of those subtypes. So inflammatory bowel disease, how I remember, is of two types. We have the ulcerative colitis and we have the Crohn's disease. So in the inflammatory bowel disease we have two subtypes. So we have the ulcerative colitis and we have the Crohn's disease. Now, why is it important to remember, the two subtypes of inflammatory bowel disease? Because obviously you have to diagnose them correctly and you have to treat them correctly, because the Crohn's disease has got different treatment modality, ulcerative colitis has got different treatment modality, ulcerative colitis has got slightly different presentation, Crohn's disease has got different presentation. So we have to know like what is ulcerative colitis, what is Crohn's disease, and how do they manifest. Okay. So if we talk about the ulcerative colitis first, see guys, ulcerative colitis is a subtype of inflammatory bowel disease. And when we study the subtypes, first of all, we have to talk about clinical picture. How will the patient present? Then we have to talk about what is happening in the gut on the macroscopic level or the gross level. And then we have to talk about what is happening in the gut in the microscopic level. Then we have to talk about what are the potential complications of each disease, like if there is ulcerative colitis, what are the specific complications of ulcerative colitis, and last but not the least, we have to talk about the treatment. Okay, so let's talk about the gross feature first, like how the patient with ulcerative colitis will present to you. Okay. So guys, if we talk about the ulcerative colitis, in the ulcerative colitis, we have inflammation which is going on in the rectum. So we have inflammation which is going on in the rectum, or we can say that it starts from the rectum. So if this is the transverse colon, this is the splenic flexure, and this is the descending colon, and this is the rectum. So in case of ulcerative colitis, the inflammation, it is beginning in this rectum. So we have the rectum from where the inflammation will start, and the inflammation obviously will move or will extend upwards. Okay, so this is the start point, and this is how the inflammation is moving. And another important thing is that this inflammation is continuous. Okay, so this inflammation is continuous. So we have the inflammation which is starting in the rectum, the inflammation is moving upwards, and inflammation is continuous. So obviously, it makes an absolute sense that the patient will obviously be having diarrhea. That is for sure, because inflammatory bowel disease, whether it is ulcerative colitis or whether it is Crohn's disease, it comes with diarrhea. But the special thing is that in this case there will be left lower quadrant pain. So the rectum is in the left lower quadrant, and obviously if there is inflammation going on in the rectum, there will be pain in the left lower quadrant, and as a result of this there will be left lower quadrant pain. Now, so the second thing, this was a clinical picture, like how the patient will present. The second thing is that what are the gross findings in this case? Okay, so obviously if there is a patient who is coming to you for 6 months of diarrhea and abdominal pain and all that crap going on, obviously you will order colonoscopy because it's not infectious. It's like lasting for 6 months, you should know what is going on. So you will order a colonoscopy, and on the colonoscopy you will see what the gross findings are. Okay, so you will see what the gross findings are. First of all, you will see that okay, this is a continuous inflammation which is beginning from the rectum and is extending upwards. Okay. Second thing which you will see is that the mucosa is so damaged, and it is so damaged that we call it as friable mucosa. So friable mucosa is just a fancy word for the mucosa which is damaged. Okay, so the third thing which you will find is what are called as the pseudo polyps. Okay, so third thing which you will find is what are called as the pseudo polyps. Now I have to tell you what these pseudo polyps are. See guys, let's consider that this is the normal mucosa. Okay, so let's consider that this is the normal mucosa. Now, as a result of the inflammation, what will happen is that this mucosa will start eroding. Okay, this mucosa will start eroding here, it will start eroding here, it will start eroding here. So, as a result of this, what happens is that the basement membrane is intact, but the superficial epithelium has eroded on some places, is intact on other places, is intact on other places. So, as a result of this, we get these protrusions which are not actual protrusions, but because the side mucosa has got damaged, so we these seem as polyps. So these are called as pseudo polyps. So again, there will be continuous involvement, there will be friable mucosa, and there will be pseudo polyps. Okay, one thing more is that in the gut we have these folds which are called as hostrations or simply hostra. In case of ulcerative colitis, these hostrations will be lost because of so many reasons like inflammation going on and all that stuff. So this is what is happening in case of uh, uh, the ulcerative colitis. Now, another thing which I want to share over here so that you have the complete image is that whenever we do colonoscopy, we make sure to take a biopsy if the gut is not like the normal. So obviously in this case the gut is not normal, so the gastroenterologist will take the biopsy, and here we come to the histopathology of ulcerative colitis. Like, what do you see on the histopathology of ulcerative colitis? Okay. See, guys, when we do the biopsy, we see the histopathology, and if we talk about the histopathology of ulcerative colitis, what we'll see is that there is inflammation which is limited to mucosa and submucosa. Okay, so the inflammation will be limited to mucosa and submucosa. Okay, so this is the basement membrane, uh, this is the mucosa, this is the submucosa, and beneath the submucosa we have the muscularies, and then beneath the muscularies towards the outer side obviously there is serosa. So the inflammation, it is limited to the mucosa and the submucosa. The muscularies layer and the serosa, they are intact actually. So the inflammation is limited to mucosa and the submucosa. This is what we'll see in the histopathology. Now, another important thing which we'll see in histopathology is what are called as crypt abscesses. Now, this thing is very important. Like crypt abscesses is a buzzword. Like when you see crypt abscesses in an exam, you know it is ulcerative colitis for sure. So, when we talk about the mucosa has got these crypts, okay? You know these crypts. So let's say in the crypts there is inflammation going on. Obviously there will be so much of WBCs, there will be so much of WBCs, there will be so much of WBCs. So these are nothing but these are the crypt abscesses. So these are the crypt abscesses, which is one of the characteristic feature of the ulcerative colitis. So in the ulcerative colitis we have these crypt abscesses, we have the inflammation which is limited to the mucosa and the submucosa. So we have talked about the gross findings, we have talked about the histopathological examination, and now we have something which are called as the complications. Now, the complications can be, intestinal complication, and the complication can be extra intestinal complication. So if we talk about the intestinal complications, so intestinal complication we get something which is called as fulminant colitis, and we get something which is called as toxic megacolon. And among the extra intestinal manifestation, there are many extra intestinal manifestation, like we can have something which is called as primary sclerosing cholangitis, and then there are some other extra intestinal complication, like we can have uveitis, we can have skin manifestation like erythema nodosum, we can have skin finding like pyoderma gangrenosum, we can have something which is called as ankylosing spondylitis. But these are just to be remembered, like fulminant colitis and toxic megacolon are some of the intestinal manifestation, whereas extra intestinal complications are primary sclerosing cholangitis, which is exclusively associated with ulcerative colitis, whereas uveitis is nodosum, this pyoderma gangrenosum, and ankylosing spondylitis. These are common, like they are found in Crohn's disease, they are found in ulcerative colitis. Okay, so after this we have something which is called as the treatment, like how do we treat ulcerative colitis. So till now you have the whole image of ulcerative colitis in your mind, like the patient will come with chronic diarrhea with left lower quadrant pain. You will do colonoscopy. On the colonoscopy you will see areas of inflammation, you will see bleeding going on, you will see pseudopolyps, then you will take the biopsy, you will do the histopathology, you will see crypt abscesses, you will see mucosa submucosal inflammation. So your diagnosis will be made that okay, this is ulcerative colitis. Now, in the ulcerative colitis, what we use for treatment is something which is called as ASA derivatives. Okay, now what is ASA and what are the derivatives? So ASA is amino salicylic acid, and its derivatives, they include stuff like mesalamine, uh, okay, so other stuff, which are actually the ASA preparation. Okay, so in the treatment of ulcerative colitis we use anti-inflammatory agents first of all, and these anti-inflammatory agents are derived from 5-ASA, and these are stuff like mesalamine and other things. Okay, so these are simple anti-inflammatory drug, we can give them by oral, IV, enema, or stuff like that. Now, after that we switch to what are called as immunosuppressive agents like infliximab, like 6-mercaptopurine, And if these immunosuppressive agents don't work, if these anti-inflammatory agents don't work, then we simply do what is called as colectomy. So what is colectomy? Colectomy is like removing the part of colon which is inflamed. Let's say rectum is inflamed, you remove the rectum. Let's say descending colon is inflamed, you remove the that part, and you get rid of all the stuff which is going on. So this was the a brief introduction, I would say, or what are the important things that have to be remembered while studying ulcerative colitis. In my next video, I'll be talking about Crohn's disease. I hope this you like this video. For more videos like this, to subscribe to YouTube channel.